Hi everyone, and thank you for watching today's Clinical Education Series presentation. Today's topic is Expanding Access, Genoa Healthcare's role in HIV care with long-acting injectables. I'm pleased to introduce today's presenters, Chance Chaput and Sham Ladwa. Chance serves as a pharmaceutical program manager supporting long-acting injectable therapies for HIV prevention. In his role, he is dedicated to expanding patient access by educating field teams on LAI options and working to eliminate barriers on medication access. Chance collaborates cross-functionally with medical billing and operations teams to streamline internal processes while also fostering strong partnerships with external healthcare providers. His work helps drive high adherence rates and ensures patients and providers receive the high-touch support needed to achieve optimal health outcomes. Sham is a board-certified ambulatory care clinical pharmacist with 8 years of experience and is credentialed through the American Academy of HIV Medicine as an HIV pharmacist. His focus is on patient-centered chronic disease management and prevention, including HIV care, through patient education and monitoring of medication efficacy, safety, and adherence. Sham has supported Genoa Clinical Services Comprehensive Medication Management Services program and currently supports our Specialty Clinical Management program to maintain specialty accreditation of Genoa pharmacies and provide direct patient care. Without further ado, I will turn the presentation over to Chance. Take it away.
Thanks, Shannon. And thanks everybody for joining. Glad to have you. Genoa Healthcare operates a unique integrated pharmacy model, which embeds itself within behavioral health and community healthcare clinics. This approach ensures that patients receive stigma-free, personalized care in a familiar and supportive environment. Genoa's HIV services include comprehensive medication management, refill synchronization, adherence monitoring, prior authorization, and financial assistance navigation. And patients benefit from 24/7 clinical support and free medication delivery, which enhances convenience and continuity of care. And notably, Genoa has demonstrated adherence rates of up to 91%, significantly higher than national averages. The organization is committed to serving vulnerable populations, including the LGBTQ+ community, and those with co-occurring conditions by providing culturally competent and accessible care. And I will pass it over to Sham.
Thank you, Chance. Thank you, Shannon, and everyone for joining. Next slide, please. So on this slide, we're introducing the main long-acting injectable therapies currently available for HIV treatment and prevention. For HIV treatment, we have 3 key options. There's Cabenuva, the combination of cabotegravir, an integrase inhibitor, and rilpivirine, an NNRTI or non-nucleoside reverse transcriptase inhibitor, which is administered intramuscularly every 1 to 2 months. There's Sunlenca or long-acting lenacapavir, a capsid inhibitor, which is given subcutaneously every 6 months in combination with other antiretrovirals or ARVs for highly treatment-experienced patients. There's also Trogarzo, an IV infusion of evolizumab, an anti-CD4 monoclonal antibody, which is administered every 2 weeks in combination with other ARVs for highly treatment-experienced patients. For HIV prevention, there are 2 long-acting PrEP options or pre-exposure prophylaxis. There's Apretude, which is also long-acting cabotegravir given intramuscularly every 2 months. There's also Yeztugo, also long-acting lenacapavir, which is administered subcutaneously every 6 months. Of note, Sunlenca and Trogarzo go through specialty channels, and these cannot be obtained through Genoa. Together, these medications represent major advances in HIV care by offering alternatives to daily oral therapy, increasing convenience, and improving adherence potential. Next slide, please. On this slide, we're looking at an overview of Cabenuva, which is long-acting combination of cabotegravir and rilpivirine. Cabenuva is approved as a complete HIV-1 treatment regimen for patients who are already virologically suppressed or undetectable and have no resistance to either drug. These injections can be administered monthly or every 2 months, depending on the patient's needs and adherence assessment. To initiate monthly treatment, patients receive a higher initiation dose of 600 milligrams Cabenuva and 900 milligrams rilpivirine, followed by a maintenance dose of 400 and 600 milligrams monthly. To initiate the every 2-month treatment, patients receive 2 monthly initiation doses of 600 and 900 milligrams cabotegravir and rilpivirine, then continue this dose every 2 months. There are several important warnings to keep in mind, including hypersensitivity reactions, potential hepatotoxicity, and depressive disorders. The medication also persists in the system for a year or more. So when stopping or switching therapy, a fully suppressive regimen must be started to prevent loss of virologic response and development of resistance. Common side effects include injection site reactions, fatigue, fever, headaches, dizziness, nausea, and rash. There are measures that can be recommended to reduce these side effects, such as walking immediately after administration, placing ice, or using over-the-counter pain or fever medications. And finally, we have to be mindful of drug-drug interactions and specific contraindications, such as CYP3A and UGT1A1 and 1A9 enzyme inducers and inhibitors. For example, there are contraindications due to interactions with drugs that induce CYP3A, which may affect plasma concentrations of specifically rilpivirine by increasing the drug's metabolism. Such drugs include carbamazepine, rifampin, and even over-the-counter St. John's wort, which all induce CYP3A4. Drugs that are strong inducers of UGT1A1 and UGT1A9, which also include carbamazepine and rifampin, among others, may decrease the plasma concentration of cabotegravir. These type of interactions could significantly decrease concentrations of Cabenuva and reduce antiviral efficacy. Next slide, please. This follow-up slide highlights the most common every 2-month dosing schedule for Cabenuva. Cabotegravir and rilpivirine are given separately in 2 injections, typically in opposite gluteal muscles. The key takeaway here is that Cabenuva represents a major advancement in HIV treatment by allowing patients to replace daily oral therapy with reliable, long-acting injections. Now we'll move on to Apretude, which uses a similar long-acting approach, but is indicated for HIV prevention rather than treatment. So Apretude contains long-acting cabotegravir, as I mentioned before, and is approved for HIV-1 prevention, or PrEP, in at-risk adults and adolescents. To begin therapy, patients receive 600 milligram injections 1 month apart. After that, dosing shifts to an injection every 2 months, typically administered in the gluteal muscle. A critical safety message is the risk of resistance if someone acquires HIV before, during, or after Apretude use, as cabotegravir on its own is not a fully suppressive regimen. Also, because the drug stays in the body for at least a year after stopping, ongoing HIV testing and monitoring are essential to reduce the risk of HIV infection and the subsequent development of drug resistance. If possible, it is recommended to start oral PrEP within 8 weeks after Apretude is discontinued if the patient remains at risk for HIV exposure. We also want to monitor for hypersensitivity reactions, hepatotoxicity, and depressive symptoms. Common adverse effects also include injection site reactions, diarrhea, headache, fatigue, nausea, dizziness, and symptoms related to sleep and rash. There are also important drug interactions to consider, particularly avoiding strong inducers of UGT1A1 and 1A9, which can reduce cabotegravir levels, as mentioned previously when discussing Cabenuva. Next slide, please. This slide reinforces the first two initiation doses and every 2-month maintenance schedule for Apretude as we wrap up its overview. The key point is that Apretude offers a powerful, long-acting PrEP option for individuals who may struggle with oral PrEP adherence or who prefer less frequent dosing. Next, we'll shift to Yeztugo, a newer option with an even longer dosing interval.
Thanks, Sean. So a quick overview on Yeztugo, which, as mentioned earlier, is long-acting lenacapavir. This is the newest LAI for HIV prevention that is on the market. It was approved by the FDA in June of this year, in 2025, and it is the first 6-month injection for PrEP. So it is a first-in-class novel mechanism of action, HIV capsid inhibitor for PrEP. The dosing schedule does include loading tablets or oral loading doses. So there are 2 products that are dispensed to directly to the provider for the injection. The first is 4 tablets of lenacapavir, 2 of which are taken the day of the injection, and then the other 2 tablets are sent home with the patient to be taken the day after their injection. The oral tablets for lead-in therapy is only for initiation. So once they have that first injection, as long as they get their injection within 26 weeks or about 6 months thereafter, there's no need for oral tablets as part of therapy. Tablets can be taken with or without food. And again, those are sent, the second round of tablets, the last 2 tablets are sent home with the patient to be taken the day after their first injection. One thing to look out for with Yeztugo is there needs to be risk if back up. For warnings, there is risk of resistance if HIV-1 is acquired before, during, or after use. So there does need to be a negative HIV test on file and reviewed by the provider before initiating therapy on Yeztugo. Drug may stay in the system for 12 months or more. Again, again, to Sham's point about monitoring HIV status while using Yeztugo. Common adverse reactions, again, after the injection is injection site reaction, headache, nausea, and a low incidence of that. Similar, again, echoing the drug interactions, so wanting to avoid the UGT1A1 and CYP3A inhibitors. And here's kind of just a visual of the dosing schedule for Yeztugo. Again, 2 oral tablets, so 600 milligrams total of oral lenacapavir, along with the 2 injections. The injection kit itself does come with 2 1.5 ml vials of product. So they get 2 oral tablets, 2 injections, and then on day 2, immediately after the injection, the other 2 tablets are taken, and then their injection every 6 months thereafter. So next I'll go into the benefits of LAIs in HIV care. Long-acting injectables address several barriers commonly encountered in HIV care. They help mitigate pill fatigue and improve adherence by reducing the frequency of dosing. These therapies also reduce the stigma associated with visible medication use, offering patients greater privacy and discretion. Improved retention and care and reduced viral transmission are additional benefits, as patients are more likely to remain engaged with their treatment plans. By offering a more convenient and patient-friendly option, LAIs enhance the overall experience and outcomes for individuals living with or are at risk for HIV. Genoa Healthcare plays a critical role in the implementation of long-acting injectable therapies. Through partnerships with organizations like ViiV Healthcare and Gilead, Genoa serves as an alternate site of care for administering LAIs. The operational workflow includes coordinating with providers for injection scheduling, educating patients on therapy readiness, and managing inventory and cold chain logistics. Genoa's infrastructure supports scalable services across multiple states and care settings, ensuring that patients receive timely and consistent access to these innovative treatments. This model facilitates seamless integration of LAIs into routine care and enhances collaboration between pharmacy and clinical teams. Genoa Healthcare is also deeply committed to health equity and expanding access to HIV care. And by embedding pharmacies within community health centers and community mental health centers, Genoa reduces logistical and systematic barriers to treatment. Genoa's experience with behavioral health integration also enhances its ability to serve individuals with complex needs. These efforts ensure that all patients, regardless of background or circumstance, have access to high quality and compassionate HIV care. As far as partnerships, there are numerous opportunities for research and collaboration with Genoa Healthcare's HIV service framework. Genoa offers a platform for exploring adherence outcomes, implementation models, and health economics and outcomes research. Genoa's robust data infrastructure and partnerships with PBMs, academic institutions, and community organizations make it an ideal collaborator for innovative HIV research. By identifying gaps in care and leveraging Genoa's capabilities, stakeholders can develop impactful studies and interventions that advance the field of HIV treatment and prevention. And I will pass it back to Shannon. Thank you all for joining.
Yes, thank you so much. And Shyam and Chance, thank you so much. This was very informative, and hopefully the audience has a lot of takeaways from this to utilize in practice. So this concludes today's presentation. Thank you all again for tuning in. As a reminder, all of our clinical education series presentations are housed on Genoa's YouTube channel at www.genoahealthcare.com/center-partner-resources. Thank you again and have a wonderful day.
Thank you, Shannon. Thank you, Chance.